In a kyphotic posture, we know that we get an increase in the thoracic kyphosis, but that can often be paralleled by the scapula moving out and moving around the rib cage, so scapular abduction. So if I just turn my back to the camera, in this position my scapulae are lying closer to the spine, but if they abduct, it draws the arms forwards, and as it does so, I can flex the thoracic spine. So what I'm using now then is a taping to try to correct both of those. So I'm going to put an X across this area so that the center part of the X is close to the stiffer part of the thoracic spine in terms of the patient's symptoms. And then the X itself is going to draw the scapula downwards and slightly inwards. So I'm using, to start with, a mesh under tape to give a little bit of skin protection, and then the tape that goes on top will be a stronger zinc oxide tape. So to start with then, I'm just going to lay this tape on the area where the patient has their symptoms. So I would vary this up and down the thoracic spine. All right, so once I'm in that position, I'm then going to use a zinc oxide tape, which is far stronger. And this can have two effects. So firstly, it's going to pull on the skin. So it has a physiological effect on the skin reflexes. So it will change awareness of the movement. The second effect it can have is if I put enough of it on and the skin is tight enough, then it's going to have more of an anatomical effect. So it's going to brace the area and prevent unnecessary movement. So in either way, what I'm going to do is pre-position my patient. So if she is very rounded, then what I would do is put something under that shoulder. So if I use a block, I can place that under the shoulder, and it just draws the scapula into its position, the more optimal position. And I would normally have one on either side. So all I'm doing is taking my zinc oxide tape, I place it onto the under tape, and then I'm pulling the skin. So I want a little bit of drag on the skin. So I'm taking up some of the laxity of the skin itself, so that when I move my subject away from the couch, it still feels tight. Because if I put it on in a lax position, then the skin will simply slide with the tape on top. So all that's doing is giving them the feeling that somebody is taking hold of their skin or their shirt and pulling. So it's a little bit like, if I'm rounded in this position, somebody pulls here, it gives me that knowledge of extending my thoracic spine. So it's not going to fix the position. It's not rigid enough to do that. We would need a spinal brace to achieve that. But what it will do is give some awareness, some kinesthetic awareness of the movement. So it's an equivalent to you putting your hands on the patient and performing a tactile cue. This is a tactile cue, which is simply with the patient throughout the day. And the taping, if it's prepared and the skin is prepared, will last for about 48 hours. So within that time, there's a good ability to try to re-educate some of the knowledge of the position of the thoracic spine.